This isn't my jam.
Yeah, I know. We've run out of strawberry.
We never run out.
Not usually, no, but I forgot we were so low. Oh, Luke.
I don't want this jam.
Yeah, I know. Just give me 5 minutes. Tell you what, I'm going to nip to the shop and go and get you some strawberry. And then we can have breakfast all over again. Start from the beginning, OK?
Don't forget, Mum. Strawberry, the rest are rubbish.
Hello?
Hi, it's only me. I'll be in a minute.
Dying alone like that. It's really sad. No, Evelyn, it's just careless. Everybody should have someone.
Right, I'm back now. Luke. Should we start breakfast again?
I'm not hungry.
Why don't you give the TV a break?
I'm busy, Mum.
You could read that book you like. We could go out. What do you think?
I was age 5 when I decided to become a doctor.
Hi.
How are you feeling? It's okay.
It's good to see you.
That dramatic exit the other...
Doesn't matter. I'm just glad you're here.
I'm sure Gordon doesn't need to know all the gory details.
If I'm registering, I might as well know what I'm getting into.
And watch out for my fellow receptionist. I mean, she's a bit of a pain in the proverbial, but barks worse than a bite. Morning!
Mrs. Tenby, what a lovely surprise.
What? Oh, you know each other?
She's my good Samaritan.
No.
To tell them what you did.
Go on, we're all ears.
Come on, out with it. The church ladies and I had made preparations. We were expecting Reverend Clement at any moment. Then a homeless man appeared. It was a very difficult situation.
What she's trying to say, very nicely, is that they wanted to send him packing.
No, not... Well, perhaps. I did not think it was a good idea, so I made him a cup of tea.
Very nice it was, too.
Hang on, I'm confused. Who's the tramp? You? Most unconventional. You were testing them.
No, I just wanted to see the place as an outsider, not your typical middle-class churchgoer.
I love it, nice story. Well done, Mrs. T.
Right, will you give him a registration form and I'll put the kettle on?
Got any help notes?
Luke? Luke. The blood in the toilet, where's it come from? Have you hurt yourself?
Yeah.
Right. Where does it hurt? Show me.
When I weed and my stomach's bad too and I don't feel well.
Yeah, it's okay. It's okay. It's okay. I'll call a doctor.
Now then, exercise.
Yeah, you do not find the time.
And that was I thinking I was a fine figure of a man. What about here? It's asking me to specify a primary doctor.
Oh, no. I would strongly recommend Dr. Heston Carter.
Karen mentioned Jimmy?
Oh, yeah, good, but not as robust as Dr. Carter.
Why don't we hold off a moment? I was hoping I'd run into you. I'd like your help with something if you have the time.
Really?
I'm thinking about making a few changes at St. Bernadette.
Changes?
I want to encourage new people to come to church. How does that sound?
Yeah, well, I am not sure that...
Let's together soon. Bounce around some ideas.
You know, I'm not complaining, but Shouldn't you be at work?
I've taken the day off so we can talk.
Okay, good. Look, I'm sure we can find a way through this.
Good. I was hoping that you'd see.
No. I haven't changed my mind. I'm ready to set a date.
I know it's a bit awkward talking about this stuff, but I'm just not getting a very clear picture.
Well, Luke, she can't help you if you keep clamming up.
All right, Mum.
I've asked a lot of questions, I know. It's just that there are quite a few possible causes of blood in the urine.
Like what?
Let's just find out a little bit more first. Shall we try again? Okay, so I was asking about the pain. Did you feel it before you went to the toilet?
No.
So it started when you urinated?
Yeah.
And was it a burning sensation or a sharp pain?
Pain, yeah.
I need to know which.
It's his echolalia.
Repeating what I say.
Yeah, or people with the autistic spectrum, they get it when they get stressed. You're best off asking him one question at a time.
Right. Was it a burning sensation? A sharp pain?
Yeah.
And did you feel it in your side? In the stomach?
I don't know, like...
He said there was. He said he felt ill.
Right.
Well, so what is it? Do you know what's wrong with him?
Not without a referral, I'm afraid. Luke's been to hospital several times in recent months.
Yeah, it gets better, and then there's something else driving me nuts.
Well, I'm sure we'll get to the bottom of it. I'll go straight back and ring neurology. Given the seriousness, hopefully Luke will get an appointment later today, okay? Is it just the two of you?
Yep, 24/7.
Must be quite stressful. Do you have any support?
I got fed up explaining to stupid people who couldn't accept him for who he is. He's best off with me.
Sure. I'll let you know when I hear anything. Try not to worry.
Can't you see that this is a reaction to everything that's happened? You've had to make a total adjustment to your life. Emotionally, you're still dealing with it. You still need time.
Oh, come on. The great healer. I've had more than enough, trust me.
Well, this is the best that you could come up with. I have got patients who are severely disabled, who are terminally ill, and they grab hold of life. They squeeze every last ounce of it they can.
Well, good for them. Maybe they're stronger than me. I don't know. But it doesn't change how I feel, does it?
Look, in a month, a year, you'll probably feel totally different.
No.
You can fight this.
I don't want to.
Fine, all right. Let's just say for an instant that I do. What now? What, I book 2 weeks leave from the mill and we jet off to Disneyland?
Probably got great wheelchair access, but not really my style, is it?
Well, let's get our diaries out then. Find a window and then we can plan the last few days.
Stop it.
No, I will not sign up to this insane plan of yours.
Actually, if you do have the odd spare moment...
Yeah, go on.
I'm hoping to draw new people to St Bernadette's, make it a bit of a hub for the community.
Chock-a-block at work at the moment, actually. Irregular shifts.
And I've just finished an HCA course and there's loads of homework and such.
Well, if you change your minds, you might be surprised by what we've got to offer.
Any chance of that Brian Cox? He's about as spiritual as I get, really.
Well, that could be a stretch. I should be getting back. Shall I make that appointment on my way out?
Yeah, with Jimmy Clay?
Mrs. Temby recommended a Dr. Carter?
Oh, no, it's too stuffy. Go with Jimmy. I'll fix it up for you.
And I will get you out of this maze that is called Leatherbridge University. Come on. Heston, the Reverend Clement.
Oh, Gordon.
Ah, the new shepherd of the good people of Leatherbridge, Dux Gregis.
Thanks.
So, Jimmy's got a slot on Thursday at 1:50.
Great, put me in.
Done.
Thanks. You'll let me know as soon as you're free.
Yes, I suppose so.
Did you order Jimmy back for an appointment for Luke Allington?
What? Yes, Dr. Keynes is seeing him at 12:30.
Problem?
I did a rotation with him at med school. We didn't exactly hit it off.
Where's that?
He didn't like being told he was wrong, especially by a student.
Oh, I can imagine. Proud man, Ken, but he knows his stuff.
He's a friend of yours.
Yeah, from my old surgery days. I wouldn't worry. It's probably water under the bridge.
Luke, come and sit down.
So what do you think's wrong with him?
He appears to have some pain in the pelvic area.
And in the stomach?
Well, Luke didn't indicate that when I examined him.
Yeah, but before he said that's where it hurts.
Luke, stand up. Show me again where the pain is.
Here.
Those are your kidneys.
He means lower down.
It's best if Luke speaks for himself. Show me again. Could you be a little more specific?
Dr. Diamond would know.
See your family GP?
Been in and out of here so often. Seen that many doctors lately.
Yes.
Well, why can't any of you tell me what's wrong with him?
It's a little difficult when a patient presents with such a variety of symptoms.
You're not taking this seriously.
I assure you that I am. Now, my problem is deciding how best to proceed. Our nurse, you see, tells me that the urine sample she took from Luke before our appointment showed no sign of blood.
No, it doesn't mean it's not going to happen again.
You see, I prefer to see it as a positive.
Right, so that's it. You're not going to do anything.
Actually, I've requested that Luke be admitted for the time being. We'll run some more tests, see how he does. That okay with you, Luke?
Yeah?
How about we roll back that last conversation and start over? Look, I can't think straight until we've cleared the air about Valentine's and what I said.
Okay.
I was angry. I shouldn't have told you like that.
Kept me in blissful ignorance.
Maybe. Then at least I wouldn't be worried that it would affect your decision.
What's his name?
Howard.
Right. You know, I've been cooped up in here all weekend. I could really do with some fresh air. What say you take me and my body out in the garden for a bit?
Yeah, she's talking to him now. I don't understand, why does he need a social worker? No, nobody's telling me anything. He's the practice manager at the mill.
So you met recently?
No. We worked together at PCT. We were involved for a while and then...
What?
We stopped seeing each other for a bit. Since last January.
When I had the accident. Come on, that's not your fault. There's no way that you could have predicted that.
Why do you have to be so bloody reasonable?
Sorry.
Didn't you think why I was so late getting to the hospital? I'm sorry. That was cruel.
Yeah.
Sam,
I'd love a cup of tea.
I've just seen Maggie Allington.
And you are?
Dr. Keller, her GP. Don't you remember me? I did my rotation with you in urology.
Oh, yes.
No one's telling Maggie what's going on. Why have you called social services?
I've asked them to do an assessment of mother and child.
Oh, why? For what reason?
As a precaution. There are certain issues regarding Luke's care by his mother.
What issues?
See, I'm afraid I've got a meeting. Rest assured they are in expert hands.
I refer them to you. If there's a problem, I'd like to know.
I'm putting a little distance between Luke and his mother. See if his condition improves.
Wait, you're suggesting this could be her fault?
Well, I wouldn't go as far as that. Perhaps she's using the situation as a cry for help.
Munchausen's by proxy?
Fabricated or induced illness, as we now refer to it, is a long way down the line. She may not be harming Luke, just seeing problems where there are none.
That doesn't make sense. Why would she do that?
Stress? Exhaustion?
Well, she's under a lot of strain, obviously, but that's because she's worried about Luke.
Yes, I'm not in the habit of having my medical opinions questioned by junior colleagues. But if you insist on my spelling it out to you...
Please do.
Luke's been admitted to this hospital 8 times in recent months. On each occasion, he's had different symptoms. Now, we've been unable to make a diagnosis, despite his mother requesting all manner of tests.
Maggie didn't ask to come here today.
Yet here she is. And once again, her son's miraculously improved on admittance.
There's a reason. Something missing.
The proverbial gut feeling. Thought you'd have got past that by now, Dr. Keller.
We always knew that we were playing with fire. But one day, one of these affairs might become something else.
My relationship with Howard doesn't change things between us. I don't love you any less. Listen to me. In all the years that we've been together, I have never, not once considered leaving you for someone else. Not then, not now.
But you love him.
I love you both. That's why this is such a mess.
I'm tired. I need to rest.
Well, we didn't mess around with that.
What does it do?
It administers oxygen.
Can you give me some?
I think the nurses would string me up.
Tie you up?
Get very cross with me.
Why haven't they put me on it?
Well, it's generally for patients who don't have enough oxygen in their blood. But that's a good thing that you're not on it. It probably means you're getting better.
I'm not better.
What do you think's wrong with you?
He'd know.
You, Dr. Cairns? Maybe.
I like it here.
The hospital? Surely you'd rather go home, see your mum?
No. Not really.
How's Luke? Have you seen him?
He's doing fine, much better.
So they know what's wrong.
You should really speak to Dr. Cairns.
Did he tell you why he called a social worker?
I can't get into this, I'm sorry.
Is it something they think that I've done? Is that why you're not telling me?
They just want to make sure that Luke's okay.
What does that mean? You're supposed to be here to help me, be on my side.
It's not about side.
Then why aren't you in there backing me up, telling them I've done nothing wrong?
When I saw Luke just now, he told me he wants to stay here in the hospital.
No, you lying, he wouldn't say that. I love that boy more than anything in the world. And I'm the only one who's been there for him. I even turned my back on my own family because they didn't understand him. And if I thought for 1 second that he'd be better off without me, I would walk away in a heartbeat. Do you understand?
So, how well do you know Reverend Clement?
Gordon? Well, me and Rob have known him for years.
Oh.
You two seem to have hit it off.
Well, he is seeking my advice on some spiritual matters. He is coming to me as a respectable member of the church community.
So what's your problem?
I'm really struggling to work this man out.
Well, he's a straight-up guy.
who turns up at his new church dressed as a tramp?
Well, likes to keep people on the towers.
I do not think he will be the right fit for St. Bernadette's.
Well, what about that WI lot you're always complaining about? They could do with a shake-up, couldn't they?
Like them, I see church as a serious affair. And pantomime should be left at the theatre.
Hi, Heston.
I've just had Patrick Cairns on the phone, and I'm afraid he finds your continuing presence there unhelpful. Is everything okay?
The honest answer?
I know he can be a bit of a bully.
Maybe he's right. Medically, no one can find anything. All the boys' tests have come back clear.
But you don't sound convinced.
Well, my head says one thing, but my heart...
Now, the disagreement you had in medical school, was he right about that too?
Thanks, Heston.
Did you see him come out?
Luke, no, what's happened?
They've lost him. Social worker's gone to get security.
He must still be inside the hospital. Can you think of anywhere he'd go?
But he's probably terrified. I've got to find him.
Wait!
Okay? Yeah.
Your catheter's leaked.
Just leave it a minute. I never answered your question. I made up my mind long before you told me about Howard. Sometime after the stroke.
We don't know how permanent the paralysis is. Some feeling might return.
Let's not pretend. I've spoken long and hard with Heston about my prognosis. I know exactly what the future holds.
He's wrong.
Or you find the truth unpalatable.
I know you. This isn't rational thinking. Can't you see this is depression?
No. It's this. The reality of how I live my life.
Your heart, it ain't getting enough oxygen right now, so... The myocardial ischemia, it's getting worse. We may be able to perform an angioplasty to save your heart, but there are risks.
Is that your diagnosis? Where did you learn all that stuff?
From the best.
Oh, yeah? Who's that?
Dr. Diamond.
He works here.
No.
So when did you meet him?
How would I do that?
I don't understand. Which hospital is he based at?
Emergency 911.
Are you okay?
Oh, it's nothing.
Pinch here, lean forward, breathe through your mouth. Emergency 911, that's a name for a TV show, isn't it?
Dr. Diamond's the best. Always gets the diagnosis right.
So, what would he say about you?
Any symptoms, he knows what it is.
Even if what you told him wasn't true? The blood in the toilet was from your nose, wasn't it?
You're better than I thought.
I've done a wash.
Sit down.
I need to change the sheets. It'll only take me 5 minutes.
Please, will you just sit down? I don't want this to be our lives anymore. I'm sick and tired of you and Chris clearing up after me all the time.
It's second nature.
Well, not to me, it's not. You have no idea how humiliating it is.
Oh, fine. Wallow in your own self-pity. The Sam Reed I fell in love with. He could talk to me for hours about history, charm me with romantic poetry.
For how long? Until the next stroke?
What matters is that you are here, now, with me.
Yeah, with no freedom and no dignity. I want my control back, Emma. I want to choose how and when I die.
What about my choice? What about Chris? Have you thought exactly what you're going to say to him?
I've wasted everybody's time.
The important thing is that Luke's okay.
Yeah, well, should have known, should have realised what he was doing.
Well, it's hard to step back when you're so close to things.
He's always watching TV. It's what keeps me up half the night.
Which must be exhausting for you.
Yeah, well, things wouldn't have gone so far if I'd been thinking straight.
If there's anything else you need, just let me know.
You must have thought about it. Planned it in your head. How are you going to tell him? Over dinner? Like you told me?
Don't make this harder than it already is.
Hard. I'll give you hard. You're the one who's going to have to look your son in the eye and tell him that you're abandoning him. Explain why his feelings don't matter. Why destroying him doesn't matter.
All right, that's enough. All right, that's enough. Now just stop it.
All right, Dad.
Well, now's your chance.
That weekend was absolutely amazing. Right, I reckon I know pretty much all there is to know about the human heart. And I went to the castle, the dungeons, I saw Arthur's seat, as if, right, there's an extinct volcano.
He was happy to accept that we'd had an affair. Anything that bolsters his death wish.
What do you think you're doing, you stupid...
My dad.
What?
My daddy's fallen. He can't move.
Where is he?
For you to be there at our wedding today, it would mean the world to us both.
Go to hell!
Well, I couldn't have imagined this.
Neither could I.
Del Boy's bestest friend